kind of like you're going to be coming into Fort Knox. So there's a lot of questions we're asking. We want to know if you've traveled in the last 14 days, if you've been in contact with a sick person that's traveled, if you've had an exposure or tested positive for COVID-19. And then if you have any symptoms. So there's a lot of symptoms that we ask about because COVID-19 has a variety of different symptoms. And we're asking to make sure that you're not experiencing any of those symptoms the particular day that you're here. High-touch surfaces are disinfected twice daily. Patient rooms are cleaned daily, and of course any equipment or furniture, things that we use maybe during your appointment, is cleaned after following that appointment, so it's clean for the next person. So for the general public, just think about any time you touch a surface that you could potentially pick up some microorganisms, including COVID-19. If you've had to touch the elevator button or a door handle, then think about cleaning your hands right away as soon as you see alcohol-based hand rub available. And they are available throughout the building, so it is generally pretty easy to find some hand sanitizer. Clearly, our waiting rooms were quite crowded previously, so we couldn't continue to operate that way. But in order to fit enough chairs to accommodate the appointments that we do have, we have ordered like plexiglass dividers between the chairs, so that there's no risk of droplets, respiratory droplets from one individual passing to the next individual, because you've got that solid barrier in between you. I hope it's not our norm forever. I hope we get through this and we're not having to take all these extra precautions all the time. But yes, definitely for the foreseeable future, until we have enough of the population immune to the disease, so either through natural immunity or through the vaccination. So with respect to patient placement, so if we have individuals that are being admitted to hospital and they are symptomatic with any of the signs and symptoms of COVID, we are trying to get them into a room by themselves, or at least in a room where they can spatially separate from their roommate until we have those initial test results back and we can say, okay, well, it's not COVID, it's a different cause for their admission. Unfortunately, with COVID, it's a novel respiratory infection. So what that means is that the general public, none of us have immunity to it. So our healthcare workers are susceptible, patients are susceptible, visitors are susceptible. So anybody could come down with this infection, which does appear to be relatively easy to spread. So we don't have the same, it's not the same as the flu, because we just don't have that immunity.